Right. Good morning, everybody. Happy Friday. I feel like it's been a while since we've all been together. I'm really glad to see you all. Um, just looking to see who might be new in this space. Debbie, I think you might be our newest local system of care coordinator. Have you had a chance to meet everybody yet? Do you want to introduce yourself? I don't know if you've popped into other spaces. Hi. You looking for your mute button, Debbie?
No, my internet just froze for a second, so
Oh.
I apologize.
You're fine. You're fine.
Oh, I didn't know what you were talking to. What
Yeah.
did you? Yeah. Hi.
Hi. Have you been to a system of care space yet? Forgive me. I've been out a
Yeah,
couple.
I've
Okay.
been to
Okay.
a couple of them so far.
Okay. All right. Fabulous. Well, welcome. Glad you're here. Um, okay. Well, welcome to the April System of Care Grantee meeting. This is a quarterly meeting where we just check in on all things related to the System of Care grant. And today we're going to talk a little bit about the System of Care Infrastructure Survey that we're about ready to launch. So, really excited to get that out to all of you into your region, start collecting some really valuable data. And today is really just to check in. I sent out a lot of information, I think the week before last. So hopefully you've had a chance to kind of read through all of that and take a look at the actual survey. And so today, I really just want to make sure we answer all of your questions. And if you have any concerns or additional supports before we put this thing out in the world, today is the day to talk through all of that. Um, so before we get started, is there anything else related to the grants that people want to make sure we touch base on today outside of the survey? Okay. All right. Well, what would be helpful? Hoping that people had a chance to kind of look through it, but if you haven't and you'd prefer we kind of walk through it together, I'm happy to kind of pull it up and we can talk through it. I guess where would be helpful to start? Do you have like specific questions or concerns about the survey? Really open to however you want to take this. Did everyone have a chance to look at it and play with it a little bit? Roxanne.
I'm curious as to how you got the numbers for how many participants need to take the survey for each region,
Yeah.
because that is kind of wild to me to look at the numbers that are on there.
In terms of what?
Well, Jackson County is quite the different beast than Curry County is in population and services and all of that, and they're expected to have the same number of survey responses.
Yeah. Yeah.
Mhm.
So this comes from a national tool, and in that national tool, it suggested a minimum of 10 responses per community, I think was the exact language. Because we have some differences in terms of size, we just kind of made our best guess. And by we, I mean it was me, Cody, who I hopefully is coming here, and hopefully he can come in to talk a little bit about like why the number of responses in each region is really important in terms of like validity of the data. Um,
And then what happens when you get zero responses or one or two? What happens then?
yeah, I mean, in that case, I mean, that is kind of the work that we're asking you to do here is to follow up with people in that particular county or region to make sure you get the responses. So Roxanne, if you don't mind kind of using Curry as an example, um,
Mhm.
so are you worried you can't get 10 responses out of Curry?
We did not get one single person who attended our advisor executive meeting last month. And it's the first one that we've had in a year.
Okay.
And we've been hosting full in-person network meetings every 3 months for over a year now. And we didn't get one person to attend our advisor executive. So I have high concerns
Okay.
that we will not get survey responses. Even if I offer $100 to each person who completes it, I don't know if I'll get survey
Okay.
responses.
So you're not
So
going to get responses from like those manager, director level people in those major systems.
yeah, because that's exactly what the email says is
Yeah.
manager, director level,
Yeah.
family participants. I don't even, not sure if we can get those.
Mm-hmm. Mm-hmm. Okay.
So,
So that's good to know. I think what we can offer if you are really worried about getting those people to your table, because really, I mean, this might be an opportunity to kind of re-energize and be like, no, y'all, this is like really important. And per contract, you are supposed to be here.
well,
Um,
I thought that energizing was going to happen when we had you chime in the last meeting and introduce a strategic plan.
right. So this might, this
So,
might be like, this is a requirement of our grant. Funds are dependent on our participation in this survey. And if you're really getting stuck, I mean, I think this is an opportunity for you all to like get on the phone and talk to these people about, what's going on? How do you want to engage? Why is, how is this valuable to you? And if you really get stuck, I think, let us know and maybe we can have some conversation, maybe even with our appointed council members.
okay.
And maybe from kind of a more central office-y kind of space, we can get some participation here.
Okay.
Does that help, Chris? Do you have something to add here? You got a lot of work, so lead
Yeah,
the way.
so I think I have 84. So what we're going to do is at all of we did our road show. We have one more county and so this month was doing our road show. And part of that was having the conversation around people knowing that they were going to be getting a survey. We talked in a little bit about the survey. And again, I was on the team that kind of walked through it and helped kind of determine with Jennifer and Christy and Cody. And so giving them information and then knowing that I will be like, one of my team members will be like, we'll send it out and then they will be reaching out as well. And then checking in during that period of time to get, because we have 84 across 12 counties. And our youth and family responding like that, I don't see that as an issue. It's that I see our community partners at getting lost in their emails. So we're just going to be like, we sent this out, and then we know who we sent it out to, so that we can then call and be like, hey, like this is really really important, and just really wanting to make sure that you were able to get it completed. And then also in that time frame, our plan is to go out and like maybe even create time where they can then do the survey while they're already at a meeting is our plan.
That's great. Thanks, Chris. Do other people have ideas about how they're gonna make sure the right people respond to the survey in the region?
I'm just telling them that it's mandatory and just giving them a heads up starting now. Like, hey, be expecting this to be coming down the line. We do need you to complete it. It's mandated by the state. It's just really important for us to get this feedback. And I mean, I haven't had any pushback so far, but we'll see when it gets closer how that works out. I think it'll be okay.
Thanks,
We have
Danny. Yeah.
um,
Oh,
we haven't talked about it too much, but I was thinking and actually just when Chris just said that too, about we have an August in-person meeting, and I was thinking about maybe, getting it out before that, but then if we haven't gotten any responses, really pushing it there and having people maybe complete it then, if that's not too, is August too late?
it's not too late. No. So we are giving you kind of the window of May 1st through end of September. So you have, what is that, 5 or 6 months? So
Yeah.
depending on, what's going on in your region, maybe summer is going to be a harder time. So maybe you want to try and get it, done right now before people disappear for the summer. Maybe you want to wait till the fall. But by September 30th, it's kind of like that is the hard date on which we want all the data in. Heather.
Hi.
Hi.
What is the expectation for tracking the completions of the survey? I was reading in the email that there's a unique link for each region, which is great. Um, are you are you assuming that we will have our partners confirm with us when they have completed the survey? I know when we've done surveys before, just within our own SOC, that sometimes people think they complete them and they don't as well.
Mhm.
But if you are wanting, one person from each of the different sectors, I'm just trying to figure out like what's the most efficient way to track that? Because I think that some of this becomes a lot of it does become an administrative burden at a certain point. And so is there a way, like, are you going to give us progress reports on how we're doing on it? Are we supposed to track that? What is that?
Yeah,
What's the
great question.
expectation?
Yeah, we are going to provide an export of your data.
Okay.
We were thinking kind of weekly, but if you want it more frequently than that. So,
Got it.
what we are asking you all to do, kind of in the short term, is really identify like the 2-ish week window on when you plan to collect the data and to let us know
Mm-hmm.
that. And specifically, you're going to let Cody know that to be like, hey, Cody, we decided we're going to do this survey June 1 through June 15th.
Mm-hmm.
And so Cody will note that, and then he will plan to send you an export of your data, every Friday at noon. I'm making that up, but, or maybe it's every Monday if that's what you would prefer. So you'll have
Okay.
an idea. Um,
Yeah.
and, if it feels like you're having, and you'll be able to see, per those roles, so you'll know kind of who you're missing, and who you might
Okay.
need to do a little bit of follow up with.
Okay, that makes sense. And then my other question was if there's somebody from one of these sectors, so like Marion Polk has 2 counties, if there's one of the seats is missing, what is the expectation that we just find somebody to
Hmm.
respond to it? Are you hoping they're all system of care members? Like what's the thought there?
Yeah, what do you mean a seat is missing?
So like Polk County or I mean Marion County Juvenile Justice, we don't have them currently at the table. I know somebody, but they're not a current system of care member.
Right. Yeah. Yeah. So we would want you to go out and get them to respond.
Okay.
Yeah. Even if they're not like technically, engaged or whatever. And again, this is kind of an opportunity, right? Like maybe taking the survey with somebody who hasn't really been at the table will get them thinking a little bit about like, oh, maybe, oh, maybe this is what
Hmm.
system of care is about. And you might actually get some buy-in.
Hmm. Okay.
I think I'm also going to say that I am looking at this as an opportunity to see what other people are seeing as well, which is probably why I'm a little I am actually really excited about it because and I've heard across time, people who've been doing the systems of care in my region will be like, what even is systems of care? And I'm like, you've been sitting at the table for 10 years. What do you mean, what is systems of care, ma'am? Um, and these are like people that are like dear to my heart. These are not people that I don't know or they just popped in. And so I am looking forward to seeing how other people see the work that we're doing.
That's great. I love that, Chris. Thank you. Selby.
Yeah, I'm a little bit curious about question 8.3. So it's about commitment to the system of care philosophy and approach, and it lists all the different systems and they rank it. And one of the categories is the CCO, and there's 2 CCOs in my region. And I know that people could maybe,
Mm.
you could get kind of an amalgam of, feeling about the CCOs, but like the 2 CCOs in my region participate very differently. And I can also see something funny like, one of my system of care champions is from the other CCO, even though like that CCO, I don't know, what I mean? I'm just thinking like she might
Mhm.
say, oh, there's strong commitment, but I bet if a different member assessed that same CCO, they might be like, oh, they're too much. I don't know. So I guess I'm curious about, I mean, I can just go for it, but I'm a little bit curious knowing that the 2 CCOs in my region function in a very different way.
Yeah.
If we're
Yeah.
worried about mixing those up. Um,
Well, and this would apply to you and then to Southern Oregon as well. So I don't know if Roxanne or is Tracy here, if you all have feelings about how to distinguish between one CCO and another when you've got more than one in a county.
I feel like we are pretty in for Jackson County, I'll just say, because that's my only county, but I feel like I feel like it would be fine for us, for all care and JCC in Jackson County, but that's just my, and you, I mean, feel free to, because you have more than one county that you're to, so. But I think it's fine for us.
Yeah, thanks. Yeah, Selby, I mean, to adjust this survey would maybe
Yeah.
confuse people,
But
but there is like an open-ended response where hopefully if somebody wanted to be like, hey, Trillium's awesome, but we hate HealthShare, maybe they would feel free to say something like
yeah,
that in the comments. I
yeah.
don't know. I don't know. I'm open to your ideas, but
Yeah, there may not be too much to do about it. I just thought that's just one place for my region anyway, where it felt like the
yeah,
results are going to get,
it's gonna be a little
I guess
tricky.
they'll be meaningful, but they'll be maybe not 100% reliable, I guess.
Hmm.
And then it's just probably a matter of member education and talking to them about it. But I feel like my experience when we did the SRSI was that they really struggled to not complete the survey from the vantage point of their singular system, that it was a challenge to be like, no, like the feeling of the whole thing, like if we were literally just only one children's system, how does it feel? And so again, I probably just need to try and talk to people, but I do think that's kind of I'm worried people might default um, to just, answering from their own systems approach.
Hmm. Yeah, and we are looking for people to take kind of a broader view, particularly in those like the commitment questions and then what is it? The, service delivery guided by system of care values and principles, right? Kind of like broadly. So maybe that's something, we provided you some template language for you to use in the emails, and maybe, that's where you can kind of like reiterate, kind of this broader approach. Amber.
Hi, good morning. Sorry I was late. I had a
Okay.
meeting that ran over. Okay, so I don't anticipate us getting any, I don't anticipate us having any problems getting responses, but my one concern is that we are looking for a youth and a family member to respond to the survey. And admittedly, I have not done a deep dive into the survey yet, but just at first glance, it does seem like it's a little language heavy and might be tough for them to fill.
Yeah.
So I'm
Yeah.
worried about that.
Yes, I am too. Um, and I think we're just gonna have to do our best and maybe just acknowledge like that we didn't use the plainest of language in this, really an attempt not to stray too much from kind of like the national tool.
Mhm.
Um, and I think, the other thing is like people don't have to answer if they're like, I don't know what this means, not applicable is like always an option. And I guess, like 10, like the number we gave you is like the minimum.
Mhm.
So if you have, don't think you have to be like, oh, I got to find like the one youth who's gonna, fill this out, or like the one family member. Like send it to all your youth and family. I mean, the more the better, right?
And that's my plan. My plan is to send it out far and wide in hopes that we get a good response. But I also want to do some targeted outreach for
Yeah.
partners that I know will
Hmm.
respond.
Hmm.
Um, would it be inappropriate for like one of our youth to have somebody from our youth advisory council to assist them in filling it out?
Not at all. I love that idea.
Okay,
Yeah, that's great. Yeah. I love
perfect.
that. Or maybe like to somebody else's point, like maybe it's something you do like in a meeting together. And so where they have questions about like, well, what does this even mean? There can be kind of like some group assistance in that.
Like the Wi-Fi EZ guys, like those of you that are do the wraparound, like sit and help them with the language, not what they reply.
Yeah. Okay, perfect. Thank you.
Is anyone else, I know, Roxanne had mentioned stipends, kind of jokingly, but I wonder, is anyone else paying stipends is it just for your youth and family, or that you are gonna offer a stipend for? Not, is it just, are you offering a stipend to your youth and family?
For youth and family.
Yeah, I would have to.
Are you doing like this, your standard, like off, like what you, like $50 or what you would do for a meeting then?
Yeah.
Yeah.
That's an interesting question because I can pull it up right here. I had actually developed for myself like a using the community spectrum of participation, that whole graph where you go from inform to cooperate, collaborate, lead, whatever. I did design different compensation rates for different type of community engagement. And I think we had a smaller compensation rate for just a survey, but this is an extensive survey. So anyway, I will look right now and see about that. It's not written in stone or whatever. I suppose we can determine whatever seems reasonable, but I'm going to look out of curiosity and see what I put down.
Mm-hmm. And for those who do plan to offer some sort of incentive or thank you for participation, if you want that kind of built into your region's survey, we can totally do that for you. Just this will be something to follow up with Cody about. And so, like at the end of the survey for your region, it can be like, thank you for participating. If you're a youth or family, you might qualify for bloody, bloody, blah. And then we can provide a link to whether it's like, email Danny or here's our smart sheet form or survey, however you all manage those things. We can tailor each of your regions to do that and hopefully make it a little bit easier for you to get those out.
So we already, our surveys are also like, we pay $25 for a survey. This is more substantial. I think we will pay for a full meeting because it will take them some time. We already have them. It's like, if you're taking a survey, then you just reach out to Ashley and let her know that you took the survey. And then she puts it on there to get the stipend out to them. So.
What other questions do folks have? This is good conversation. Anybody have gripes or frustrations they want to voice? We're happy to hear those too.
I always have gripes and frustrations I want to voice, but not about this group. So
Thanks, Amber.
you're welcome.
Okay. Do you folks have a sense of when they're going to be doing the survey? Have you all identified?
So for our CCO, we're doing another survey in May and June will be our collection period just regarding behavioral and physical health in general. So we likely won't be pushing it out until I would say July or August, just because of survey burnout.
Yeah, that's a great consideration. Thanks for bringing that because I'm sure others might have similar things going on. Anybody else thought about timing?
My only thought about timing is I feel like it'd be nice if we had an extra month or so because right now our school partners are getting ready for the end of school and then
Mm-hmm.
they're not really around in the summer. Things kind of slow down and then
Mm-hmm.
September is really busy.
Mm.
So our best chance of getting them to engage with it is probably, end of September, October. So it'd
Mm-hmm.
be really nice if we had an end of October due date for this.
That's such a good point, Jennifer. I didn't even think about that with my July, August.
Mm-hmm. So even if you put it out like September 15th,
That's still a hard time. I
is
mean,
it?
we acknowledge, we just as a system of care, we just understand that, locally our education partners are just sort of out of commission basically from around this time until I would say October. Like we do not try to plan meetings. We don't try to do we don't do any try to school-based initiatives until they're settled and they have their feet under them and then they're ready, say, to take on a training or, or participate in something.
Yeah. Okay. All right. That's good feedback. Let me take that back to Cody and my team. Um, Selby, at a recent ECAC meeting here, the members explicitly requested they get in meeting time to complete deliverables. So I think, okay, so you're actually going to use some meeting time.
Yeah, I've been trying to get them to send in this little worksheet for about 4 months now. And I think they're just, even though I eventually got a bunch of them and it probably didn't take that long to fill out, I think they're just so overwhelmed and tired with everything else, honestly, that they're just not, I mean, they're coming to the meetings, but their minds are definitely in other locations.
Yeah, and that's a really good point, Selby. I mean, I think my plan is to send it out via email, like, identify some members. But then if I don't get a response, to try to do it during a meeting. Just be like, hey, okay, we have this deliverable, so we don't know yet. We haven't tried to do this. So we're gonna just, see what works.
Yeah. And then that might be a little bit complicated because you might not have a meeting until it might be weeks to maybe even months. So you actually have those people together.
Yeah, we meet each month.
Okay.
Yeah.
Okay.
So
And then at the local level, a couple times a month.
Right, Jennifer, you just brought up something that, so are you going to target specific people then rather than sending it out to your whole? Okay, I was wondering that too. Like, since we only have to have 10, like, would that be a better way to do it, Christy? Then, I mean, not that we could have more than 10, but like we could definitely, for sure in our region, we can find 10 people to complete it. But then I also saw that, oh, maybe we should send it out to our whole network, which.
Yeah, that's a great question. What are people thinking about that? Are you just going to kind of go for the minimum responders? Are you going to put it out to everybody? What are people's strategies on that?
I think
Sorry, Chris. Like I said earlier, we're gonna send it out to the whole world and then do some targeted outreach. I want to get as much data as I possibly can.
Okay, that's great. Others?
I think that's us too, we will send it out and let everybody can answer it, but I'm also going to target very specific, like, hey, did you take it? Did you have that? So I know that we are meeting the number, but then also, I mean, I'm hoping that we have well more than the 84. But yeah, we're going to do a little bit of both.
And then Cody will let us know each week anyway, or however we work out with Cody, like we can look at that data and say, oh, someone from juvenile justice hasn't returned it yet. We can go directly. Is that how it's going to come, Christy? Yeah.
Yep. Exactly. Yeah. I mean, I'd say it like doesn't hurt to send it out to everybody, right? The more the better, the more data, the more valid the results. And just to make sure that we have, diversity and inclusion from all of those big players. That's kind of where the minimum comes in. All right, let me see what else is in the chat here. I think I'll send it. Selby says I'll send it out via email and also give them meeting time. I have no youth participation, so that will take intentional effort. Selby, do you want to say more about that?
I mean, yeah, I just don't have that participation. All I can imagine doing is asking if some of the wraparound programs will work with the youth of theirs for an additional stipend. But I don't have anyway, yeah, I don't have youth participation despite different attempts, but I don't have it.
Yeah.
So.
Or like other youth advisory. I thought that you all had convened a group for the wellness rooms.
Well, previous grant cycle, we did a project at Youth Era with 8 youth engaged specifically in that project, but not long-term participation. And I have found it, even with intern support, extremely difficult to get connections and responses from local youth groups. I'm trying. I would love to have a model like Heather has, but yeah, it's been hard to get responses from those different groups. So anyway.
Okay.
It's just a thing. Maybe someday if we have a staff or more dedicated effort towards it. So we're looking at it. But yes, I don't that is definitely a challenge area, I think, and yeah, don't have that. So
Roxanne, when will you give us the data from the surveys? Yeah, so Cody's
You
on here.
already answered it.
Oh, okay, okay. Yeah. Well, I mean,
Sorry.
I don't think Cody will want to do it like, more than twice a week, but when you're up and running and really wanting to know who's responding. And there might be some
Okay.
way that he can just like set up a link where you can just see the results. I know you could do that in SurveyMonkey. We're now using Qualtrics, so there might be a similar technique where he can just like build a dashboard for you, and then you can go look at it whenever you want. I will ask him if there's something like that for you, because that might be easier than having him to like export a full report for you. Okay, these are great questions. Anything else? Trisha, Heather, just kind of giving space for people who haven't asked anything directly. Becca, Debbie, Corinne, Karen. Okay. All right. Well, I think, just to wrap this up a little bit, we talked about expectations around, who you need responses for. And, as you get going and if you're really struggling, like happy to help think through how to like, um, you know, herd the cats to complete the survey. You'll all let us know kind of, when you plan to do the survey, again, picking a couple of weeks or maybe even a month if you plan to use some meeting time. Just, if you could let us know kind of your plans by end of May, that would be great. So, Cody and I will also have some summer vacations and we'll just need to figure out ways to make sure that we can kind of get you the data that you need. If you plan to use incentives and want that linked into the survey, that's also something to let Cody know about sooner rather than later. So he's got time to kind of build that in and work that out with you, make sure that's working. Um, Again, I think you all had some great ideas about communicating about the survey, starting to communicate about it now and like repeatedly as you get it out into community will be really important in terms of getting the responses that you're looking for. I don't think I have anything else on the survey, so just we can wrap up early. I do have a few kind of other grant updates and announcements, um, if that's okay. Anybody else have anything to say about the survey? Okay, so in related to that, I had a big oopsie and forgot to actually include this as a requirement in several of your grant agreements. I think it's only specifically mentioned in the Tri-County grant, in the Jackson County grant, and then I think Amber in the Yamhill grant, and all the other grant agreements we just executed, I totally forgot. So I am trusting, and it sounds like you are all on board to like participate, and that is great. I would really rather avoid having to like execute another amendment just to make sure that this is all in there. But if for some reason you think that that would be helpful in terms of like getting buy-in or whatever, like please let me know. I'm happy to do a formal amendment to make sure that the language is captured in the agreement. Another reminder, as you are getting grants out into the world and you are identifying sub-grantees, please let me know who those grantees are going to be. That's something that we need to know about as you get the money out into the world. Um, Another reminder, as you all get going, things change, things happen. So if and when you want to amend your implementation plan, that's totally fine. Anything up to $20,000, you can just do, no problem. If you want to do something more significant than that, that's just something we want to have a conversation about and like an email about. So we are all clear on kind of what changes you made, but really happy to work with you on that. These are grants, these are your dollars, you know your community's best. So really want to support whatever you all need to do as these things get moving out over the next year and a half. And then finally, just want to share that we intend to contract with the Portland State University Regional Research Institute for Human Services to do an evaluation of the system of care grants. So this was something that was articulated in the strategic plan, and we found some great evaluators that are going to help us with this. So they're going to be looking kind of at all four bienniums of the grant, so going all the way back to the initial 1921 awards, and then all of the subsequent bienniums. That will likely look like some surveys that they'll be putting out. They also intend to do some interviews, not only with some of you all, but actually also some of the sub-grantees that receive these dollars in your community. So more to come. A lot of that will be happening kind of later this summer, early fall. And if you have any questions or concerns, I'm happy to kind of talk to you about it. We could even maybe bring them to a future grantee meeting. That might be something we could do just to kind of make sure everybody's on the same page. But I think it'll be really helpful to get kind of a better sense of like all of the great work that has happened with these grants, really capture the breadth of accomplishments that have happened. You know, there's been over $20 million that have gone out to community. Yes, LB. So they'll be looking at kind of the grant agreements, the grant applications, all of your grant reports. Exactly. We're going to give them all of that data, and then they'll kind of be putting together kind of stories of what happened with these dollars over the last 8 years. So more to come, but I just wanted to let you know that that was going to be happening, and hopefully will be, a way to kind of celebrate all the great work you've been doing. So, all right. Anything else? Are there particular topics that you would all like to discuss at the next grantee meeting? Our next one is scheduled in July. I had a kind of tentative topic of talking a little bit about system of care communications, kind of like websites and swag and, kind of the various ways that you market and outreach about system of care in your region. But if there's something else that you'd all like to talk about, happy to pivot. Are there other things that you want to make sure we discuss at the July grantee meeting or in the future? Okay. Well,
Christy, before you go, so I see on here it says invoices. I know that we sent in for the first part of the money. When do we send in for the second part of the money?
yeah. I mean, I think per the grant, I'll have to get you the exact grant language. I think it's like halfway through or to
Okay, I can go look for it. That's not a
meet
big deal at all.
to meet the needs of your community. Yeah. So if, you've got year and a half still to spend the grant dollars down. A couple of regions have already submitted for their second invoice. So if that's something that you are needing to do, please.
No, I just wanted to make sure because I also have sabbatical like the last week of August and the first 3 weeks of September. And so it was like, if I needed to put it on my radar, but I can also go look at the grant. So
Yeah, that's great. I'm so jealous. All y'all having sabbaticals.
I am not. Do you want it? I don't want to lose it. I just don't want to use it.
Why?
I don't like time off. It stresses me out.
Chris.
Put out that message into the world. I'm going to cut you off, Chris, because we need people to be able to have sabbaticals available to them. We're only putting positive language around it here on everybody. It's a good thing. Every company should have it.
It's true. I agree 100%. I just don't want to use it. It's just me.
Chris.
I want my team to have it.
All right, we're gonna have a talk next week or next month at the System of Care Summit.
Yes.
Okay. All right. Well, I will see you all there. I wish you all a really nice weekend. And we'll talk to you soon. Corinne, I'm happy to hang out for a little bit if you want to chat.
Thank you.
Bye, everybody.
Thanks. Bye.